Well, it's 12 o'clock straight up. I like to be on time. Welcome back. I hope you enjoyed your lunch. Again, the food was provided by Salem's Market and Grill. They are making their entree into the Hill District. Those of you who are longtime Pittsburgh residents or like me, a native of the Hill District, know how important it is to have a venue like that in our community. So let's try to support them at every opportunity that we can, because Abdul has certainly stepped up, and we need to let him know we appreciate it. We heard a lot of good conversation, a lot of interesting conversation earlier today, a lot of heartfelt conversation. We're now going to pick up some of the challenges that the young men raised earlier and carry it. You may have noticed on the program, today's event is called Mental Health and Gun Violence Solutions, Not Just Talk, and we plan to fulfill that part of the conversation. The first thing I'd like to do, though, and we need, I'm sorry, I'm just looking, y'all don't have microphones either, right? No, okay. Earlier, Morris Turner led the conversation with some of the students from the Journey to Medicine program. He also talked about a connection to one of our first guests, End Central Catholic High School. I'm going to have Morris come back up, and do you want to do this here? Do you want to do that there? Where do you want to do it? Okay. Just so one of our first guests can hear part of the sentiment that was expressed earlier about how these incidents affect more than just a family. They affect the bigger family. Come on back, Morris.
Thank you again, Lynn and Ms. Chantel. I just really wanted to just let you know that there are blessings from your tragedy. Just in the Central Catholic community alone, I mentioned to the earlier session that we lost about 3 or 4 students within the past, 3 to 4 years. And your story, I mean, it's tragic. But when I think of, my son going to Central Catholic, and I went to Central Catholic, my younger brother, who happened to be one of your teachers when you were at Imani Christian Academy, he's not here right now, but just the whole family circle that comes around, I just want to thank you for your son and your son's memory, because it impacted my son at a point where he was applying to go to Duquesne University, where he is a freshman right now, and actually used your son's story in his college essay. So I just met you today, all right? So that's just the impact that just happened, and that's pretty much so what I wanted to thank you for. Your son's memory will be everlasting with us as well. But thank you very much.
Thank you. Thank you, Morris. That said, let me introduce, I'm sorry, you want to respond?
I just wanted to say thank you. That's it. I just really wanted to thank you for coming and even expressing that, taking time out to express your son's college essay and how Stephen impacted him in such a positive way.
So one of the things that I know for sure, having spent more than 40 years in the media, we cover the headlines. We cover the incident. We cover what happened. We show up right after it happened, and within 30 minutes, we're gone. And it's a story on the news. It's not a person, not a number. It's just another story on the news. So one of the things we want to do today is talk about the story behind the story behind the headlines. The Honorable Ed Gainey is the mayor of the city of Pittsburgh. But we're not here to talk to Ed today about being the mayor of the city of Pittsburgh, because if nothing else that I know about Ed Gainey is that when we talk about loss, Ed knows it firsthand, through family members, recently through a good friend. And that's what I want to start off with, Ed, with you, because people don't necessarily process how families, how immediate communities are devastated by these single decisions that are being made. Talk about that.
Yeah, first and foremost, I'd like to thank Lynn for holding this. I said a while ago, in this city, we don't celebrate our heroes. We don't tell them how great they were being here in the roads and inroads that they made for other people. So before I get anything, I always speak very highly of Lynn, and I want to say it here, that I really appreciate the work you've done over 40 years to advance minority media in this city. That's number one. Number two, I pray for you, and definitely the loss of your child. That's not easy. The question is, why do we go numb? And why don't we get to a situation where it seems like we're in a pandemic and not looking at gun violence as a pandemic? And I think a lot of it has to do with poverty. I think a lot of it has to do with the neighborhoods have changed from when I was a child to now. A lot of it has to do that we want to blame our children for the mistakes we made. I think that we always talk about violence and children as a way of saying, look at what they're doing out here with these guns. And always the hypocrisy is a lie. Because the truth of the matter is you don't know what you would have done in your time if we'd have had guns like they got guns right now. You don't know what you would have done. We went from fighting to shooting. In our community, there's a couple things that went wrong. And this is not just the only things, there's a couple. One is, we know what our family's doing. Let's just start there. I've been in these streets too long to know that you know what your family's doing. The catch it is, do you want to live in love or denial? And the reality is sometimes it's hard when it's our children because we don't want to see that in them. So we know how to turn a blind eye to what we don't want to see. But we also recognize that denial is death. Second is the church. I think that we've done some things that have allowed a certain element to control the corner because we're no longer there. See, the corner is ran by evil. And as I tell my church members, if Christ came back today, he wouldn't even know what a church looked like. You understand what I'm saying? Because he was in these streets. He wasn't in the building. And so we can't claim the corner if we're not present. That's number two. Number three is we got a whole lot of adults that have children that are not men and women. See, I became an adult at 21. I didn't become a man until I was 29, but I had a kid. And when you're in that situation, it's difficult to grow up and raise a kid. I know because my mother was 15 when she had me. So I'm the statistics that's not supposed to be here. So I understand that when you don't have no direction and you out here, it's job after job, it's a land of depression. I know some women, they got 4 or 5 babies and ain't 25 yet. I understand the depression that they have. But I do also understand that we got to stop pointing fingers and go help them. See, we worried about what they going to say to us if we go help. Oh, they going to cuss us out. Listen. Our ancestors been through more than that. So what you worried about them cussing you out for if you can help them? And then the last one for me is we don't have no black or middle class. We don't have no black or Latino middle class community in the city. We don't have a neighborhood that's middle class. Every neighborhood that looks like me in this city lives in poverty. That's a monster blow when the only thing you're exposed to is a life of poverty. If we don't take our children out of this city to see something different, to imagine what they can be, if we don't stop letting radio tell them they gangsters and thugs and go back through history to see that they kings and queens, then they will never be able to grow no further than what they see on the Ave. The greatest drug in the world is the Ave. Because it allures you, it keeps you, it gives you a rep, it gives you a name. You can make a name in the streets by being called killer, even though at the end of the day, the only thing killing is the death you putting on our people. We got to change that. Mama need help. Daddy's got to be around. And it's hard. Me and my daddy didn't get along until I was 28 years old. But I'm the one that watched my sister get put in a body bag. I'm the one that night to go see my sister be put in a body bag. For anybody that's ever seen that, it's a blow to watch a loved one get put in a body bag. And you still got to console your brothers and sisters and report back to your father who was messed up because his baby girl is gone. My daddy will be the first one to say, growing up, he made mistakes with his kids. I'll be the first one to grow up my oldest daughter, my change of life baby. I'm a different daddy now than I was when I had her. She's the one that brought me out of the street. Other than that, I was still one leg in, one leg out. It hurt me when I first had my daughter. And then my boys would call me like, yo, we going down Arts. Can you meet me down Arts? I used to call my mom like, Mom, you gonna watch her for me? Huh? She'd be like, no. Huh? So for 2 years, it was like withdrawal because I didn't have a daddy. So I had to learn how to be a daddy. To my next two now, I'm more of a father, even though I'm not where I should be. I'm more of a father because I'm a man now.
Chantel, let me bring you in on this. And Chantel Pizarro. Yes. We've been talking about her story for a while this morning. Her son, Stephen Eason, was shot and killed at a haunted hayride just about 2 years ago to the day, the 11th. There were several hundred kids at the hayride. To this day, the case remains unsolved because nobody saw anything, nobody's saying anything. And I want to just, the last point that Ed made, if our kids don't see anything, they don't know anything. But your son, Stephen, was a student at Central Catholic High School. He had the whole world in front of him. You exposed him to so many different things. So what goes through your heart now, 2 years later, to feel that you did all that work, and here you are on the stage talking about your late son?
Even tying back into what Ed was saying, I'm from Homewood. I grew up on the Ave, so once I had my twins, I tried to make it my business to not have them grow up the way I did, to provide them with the things that I was not provided with, to not see people selling drugs on the corner and dead bodies laying around. I didn't want them exposed to that. So I worked hard and made it my mission to make sure my children did not have to experience it. And to work so hard for so long to put my children in different environments, but the end result still turns around like my son was in that environment. It's heartbreaking. It leaves you with the question, what do we do, right? Because like Ed said, Miss Lynn said, stop talking about it. What are we going to do about it? I think our environment, we're so broken and everyone wants their own family. Where is our village? My grandmother raised us on, it takes a village to raise a child. I couldn't walk around the other end of Homewood and think I was going to cuss and be grown without someone that knew my grandmother to put me in line. And they had permission to beat me if need be. It didn't matter. So I knew, I don't care if I'm 5 blocks away, I'm gonna act like I represent my grandmother and my mother because I know I'm a representation of them when I walk out in the streets. We don't have that. I think a lot of these people are, don't touch my child, don't say anything to my child. Well, we don't mean any harm, you know. We want to get you back to this right path and what we need to be on. But back to the question, it's heartbreaking. I'm stuck in a phase of what can I do to make sure my daughter goes off to college next year, to make sure the children at Central that went to school with my son can graduate. What can we do as a community, as the adults? Because we are the role models. We are who they need to look at. And there might not be too many of us on the right path, but where are we? We can't hide behind the trees, behind closed doors, thinking that they're going to follow us. Like Ed said, we need to be on the streets. We need to be on the corners talking to these kids, because if we're not, how do they know what to do? How do they know what to do what's right? They don't, and they won't, because we have to show them. They need the examples. So what's next?
Our next two guests are going to spend a lot of time talking about mental health, but I want to get, before we bring them up, I want to get you two to weigh in on this. And Chantel, I'm going to start with you because you mentioned that Stephen has a twin sister. Talk us a little bit about where she is, and how does she cope? I mean, siblings have a bond. Mm-hmm. Twins have a different bond.
Yeah.
And now your daughter was forced to walk a walk that not many people know.
So one thing I will say, therapy. Therapy, therapy, therapy. I meet with my therapist every other Tuesday. My daughter talks to her therapist every week. It is not a bad thing. I try to tell children, I even tell my daughter, you don't have to talk to me. Don't feel pressured to come to me. I'm not going to force you to say anything to me, but you have to talk to somebody. Don't keep anything bottled up. You have to let it out. Find your safe space and express yourself. Someone that's not going to, judge you or look down on you for saying how you feel. Therapy is so important to be able to express and get some feedback on how you're feeling. Mental health is something that is so important that a lot of people do not realize. I'm shocked that my daughter has made it as far as she has. I mean, she has shown such resilience. It blows my mind. Even her maintaining a 4.0 at Oakland and having a program at Yale over the summer where she spent 10 days. I mean, she's exceeding all of my expectations for where I thought she would have been at this point. But I would have to say, I think a lot of it is she has someone to talk to. She has someone that she can trust to go to and throw it all out there, even if it's talking about me. You know? She has to be able to express that. And even with myself, I've noticed I have anxiety. For a while after my son, I couldn't park near a dark street and get out my car and feel comfortable. You know, I felt like somebody might come out the bushes. Why? I don't know. But all of that is a part of your mental health. You know, you may think that, I'm just nervous or something else, but it really may be your mental health. And it's a lot of things you need to pay attention to. Take care of you. If you don't take care of you, you can't take care of nobody else.
And I'm going to get you to respond to that, but I need you to hold on just a second. We got to take a break. We'll come right back. So welcome back. Mayor Gainey, I want you to weigh in on that too. And I think you bring a different perspective because while we all understand the benefits of therapy, a lot of times when we're talking about black males, whether they're 5 or 55, there's a hesitance to say, I need some help.
Yeah. So, yeah. See, my wife is here, so, you know, as black males, since this is black males, I'm gonna keep it on black males. There's a lot of childhood traumas that we experience. And in these childhood traumas, we try to bury it by just saying that's life and moving on. No matter you know, how severe the pain was, no matter how severe the trauma is, we have a tendency to just think about it as a way of that's life. You know what I mean? And we got to get on with it. I ain't got time for all that. Like, we got to get on with it. And it took me a long time, man. You know, like, my wife goes to therapy. My daughter goes to therapy. My oldest daughter goes to therapy. I went to therapy 3 times and didn't go back. And my excuse, not my reason. My excuse was, I just don't have the time. My excuse is, I got a city to run. My excuse is, I got a family to take care of. My excuse is every excuse I could give myself because I just didn't want to take that hour out of my time to go have a conversation with somebody. I didn't. Because that's not how I grew up. Like, I don't know any black men that went to therapy. I didn't grow up like that. So I didn't know no therapists. I didn't know no counselors. I didn't know none that came into my neighborhood. I didn't know black men that went to go see them to talk about problems they had. So I couldn't be what nobody modeled in front of me. I couldn't be it. If I'd never seen it, don't expect me to be it. So most of these young black males in the street right now, they don't know nothing about no counseling. They don't know nothing about no therapy. They have no idea what you're talking about. All they know is chuck it up, take it in, hold it in, and go get it. That's what we know. Because that's what we see every single day. Now, if you're fortunate to come from a family where they understand the power of therapy, that's different. But that's not where a lot of the black males we talking about come from. They come from neighborhoods that all they see every day is trauma. They don't even know that the trauma's multiplied because that's all they see. If I see violence every day, how can I think that's not a normal? I see violence more than I see education. We've had some school districts in this city that have had problems educationally for over 30 years. If you didn't care enough to understand that a lack of education is violence, then all you did was add to the trauma of black male neighborhoods. If you don't understand that on the block, if you're not present, the block is trauma. Don't blame the block for being the block and giving kids negative opportunities when the positive people that should be on the block are missing. So don't look at me and say, you didn't go to therapy, something wrong with you, because I'm on the block saving lives. You see, now should I go to therapy?
I'll let her answer that.
You know what I mean? My wife will say, yeah. And I did go to and I had a good therapist. I went to 3 classes. But then when my schedule got busy, it wasn't a priority for me because in my neighborhood, who did I see it be a priority for? So I'm not giving you a reason, I'm giving you my excuse because as a man, I know the power of therapy because I've watched it play out in my wife and my daughter's lives. But I have to get there from a mature situation. See, that's where I'm immature. Because I'll put that time in doing what I got to do to move this city forward than I will in myself. Because that's how I was brought up. On my block, it was a go-get-it hustler mentality. And that's a reality. We go to name a neighborhood right now. Let's go to that block. And you're going to see exactly what I'm talking about. Mm-hmm. I'm for sure about that.
Yeah.
But I have to admit where I'm still immature in order to grow. See, everybody want to act like they got it together. I don't. Mm-hmm. Mm-hmm. I don't have it together. Mm-hmm. You know what I mean? I don't. And I know I should. My daddy went to therapy. My daddy is my hero. I told you, him and I didn't have a great relationship till I was 28. But he's my hero because he had to bury his baby girl. She had 3 kids, a set of twins, you know what I mean, and a young man. I watched each one of them have to go to therapy. My daddy had to do all that. I know about the nightmares that they have. My daddy got to deal with all that. But the twins is in college. And the young man, my nephew, is doing great in school. But they all have nightmares.
We got to take another break. That's a good place to catch our breath. We'll be right back. Welcome back to a very special edition of Minority Health Matters. We've been talking about mental health and some of the impacts. And I think sometimes that people don't process, when we think about things like suicide, other violence, sometimes that can be a direct result of some of the trauma that people have experienced. Joining me now for a continuation of our conversation, immediately next to me is Dr. Dale Adair. Dr. Adair is the Medical Director for Mental Health and Substance Abuse Services for the Pennsylvania Department of Health. He serves as the Pennsylvania Department of Human Services Chief Psychiatric Officer and the Medical Director for the Office of Mental Health and Substance Abuse Services. More of his bio is in your program, so feel free to read that. We're not going to read the whole thing. Also joining us is Dr. Kelly Posner Gerstenhaber. I should have asked you that earlier. Gerstenhaber? Gerstenhaber. She's the founder and director of the Columbia Lighthouse Project. She is a professor of psychiatry at Columbia University, and her work is saving lives all over the globe. Again, full bios are in the program, so feel free to do that. And Dr. Adair, since you're sitting right next to me, pick up on the conversation that we were just kind of talking about. Our mental health is a big factor in all of this. We talk about gun violence, we talk about suicide, we talk about prevention, but we don't talk a lot about mental health, or as much as we should.
So there are actually a couple ways to look at this, and I appreciate the opportunity to come and be on the stage and participate in this conversation. One of the distinct differences that I would draw, though, important for people to be aware of, is that oftentimes whenever there is a shooting, not a shooting of one person, but more oftentimes when there's a mass shooting, the very first thing that we who work within mental health here is that we need to address mental health issues, right? And from our perspective, it's not that simple, right? What ends up happening is while an individual may have mental health concerns that leads to them then shooting, the truth of the matter is individuals who have mental health challenges are more likely to be a victim of violence than they are to be a perpetrator of violence, right? So whenever that distinction is, whenever those comments are made immediately after a shooting, this morning, the young men who were on this stage spoke a lot about stigma. What that does is it draws a distinct line to mental health with gun violence, and that's where stigma comes from, right? So someone who is then having mental health challenges will be less likely to seek help because of that stigma. They will then see themselves as being someone who is more likely to be violent, and the data does not reflect that. So that's an important piece of this. And then one other piece that I really want to make to draw some distinction with as well is the fact that when we talk about gun violence, you can actually put things in a bucket, if you would, right? So you have these mass shootings, active shooters, then you have, and I hate to use the term, so I won't use the term since I hate to use it, but you have a violent act that occurs with the use of a gun, and when you look at the who is actually committing these acts, the deaths that are due to gun violence, 2/3 of them are related to individuals who die by suicide, right? So
I'm sorry, repeat that again?
2/3.
Uh-huh.
Kelly can speak directly
Okay.
to the exact percentages, but the majority of those individuals who die by gun violence in this country are suicides. And that's one of the reasons why mental health is such an important component, because suicides can be prevented, right? There are things that we can do to help reduce gun violence in general, but suicides can be prevented, and there is a huge uptick in suicides in young black youth. So, that's definitely one of the reasons why I wanted to be here to participate in this overall conversation about gun violence.
And Kelly's about to jump out of her chair, so I'm going to bring you into that now, because, and just picking up on that point that Dr. Adair just made, I think that traditionally we haven't thought about young black males and suicide. As a community, we haven't thought about that.
Yeah, so, we talked about a lot of barriers, and I'm going to add some color to that, give the scope of the situation, but also solutions, okay? So let me just tell you what magnitude we're talking about. What do you think the #1 health problem in the world is? Cancer, smoking, AIDS, depression, what do you think? Heart disease, no. Depression is the #1 problem facing humanity. Just to put some numbers on that, 264 million people we think live with depression versus 12 million with cancer, okay? And suicide, right, takes more firemen than fire, more police than crime, more lives than car accidents, and everybody's affected. 135 people are affected by every death, and those effects linger across generations because of that silence and stigma that we've been talking about. But what we do know, this is the good news, we know that these things are treatable, and we know that suicide is preventable. But what does that mean? What do we have to do? We were talking about stigma and what we can do about it. You know that the biggest cause of suicide is this genetic, treatable medical illness called depression, right? But you don't think of depression like cancer, right? Would you ever hear the word choice when it comes to that? And you know what? That stigma, I'm weak if I ask for help, this isn't a real illness. You talked about the importance of therapy. Do you know that up to 75% of people don't get simple medicines, antidepressants, because of that stigma, right? So what we need is a culture shift where manning up is seeking help. It's a sign of strength to ask for help, okay? But what I did want to say in terms of the suicide rate, do you know that in our nation, in 2019 and 2020, we had our first reductions after 20 years of increases. But guess what? Those reductions were only among white Americans. Where we were seeing new crisis was among our minorities, and particularly black youth. Do you know that we know now that 5 to 11-year-old suicide has increased, but only among black preschoolers and black youth, right? So that barrier, that stigma is so much worse in these communities that we're very much trying to help. Well, what do we do about it, okay? We change the culture, we educate. The teacher before said, in schools, right, we should be doing this routinely. You should be getting questions about mental health and suicide. And when we start to treat it routinely, like you would do anything else, right, then that helps you when you treat it like nutrition and physical fitness, and that combats the stigma. The other very important thing that we need to do to help our black youth and our communities in general is get out of focusing on the doctor's office, because let me tell you what, people don't get to the doctor's office. They don't trust the doctor's office, and there's lots of barriers. So what we do is we screen and we ask and we identify in the church, in the community center, right? This is what we do to help bring solutions. And the other thing I want to mention is we talked about nobody said anything, right? Nobody's come forward, right? We know that people who have mental health issues are usually the victims of violence, okay? But we also do know that 90% of shooters have had suicidal issues. So we say, let's screen and ask, and maybe we can divert some tragedies, right? And I was on the phone with somebody I've been very close with for a long time. He's the head of Stand With Parkland, those 17 parents that lost their kids. And you know what he said? They talk about getting early identification. Let's get these kids help, right? And be able to give them the resources and do things like that. And he said the most important thing we need to do in the country is empower students to be able to see something and say something. And we're not doing that now, right? We're not doing it in schools and other places. So I think, those are some of the things that we really think about when we think about what we can do to help our communities and our youth.
Now, let me ask you a quick follow-up question. When you say empower our students to say something when they see something, how do we do that? Because there are all these other external factors that are going to work against that. It's not cool. You can't talk. You're a snitch. Blah, 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 blah. How do we do that?
We have to counter that with those opposite messages, right? That you're saving lives, and when people are suffering, they actually want help, right? And you change the culture so that those moments of helping the community become reinforced as positive.
Doctor, sure.
As far as that goes, even in my situation, it's not as black and white, because our children are also faced with safety issues. It's not only the mental health. So as much as I am so heartbroken that no one has come forward about my son, as a parent and as a black woman, I completely understand. Because how would I feel if I had to make my daughter come forward and I'm worried about her safety? I understand these parents who are worried that my child might be next. Witness protection is going to take me away, and just me and my child. What about the rest of my family? Because while me and my daughter may go, they can kill my grandmother. They can kill my aunt. They're not moving entire families. A lot of these communities, like Mr. Gainey said, is poverty. They can't afford it. They don't have the funds. They don't have the resources. So it's kind of a double-edged sword. And even with going to see therapy, a lot of people can't afford it. Yeah. There's no money if they don't have insurance, if they don't have a job that's just a little bit over the welfare income line. But then they can't afford the copays. So I understand, but in the same token, I don't think it's as black and white as that, because it's a lot of layers to peel back on the onion.
Yeah.
And if I can, I don't think it's just one thing. I think what Kelly offers is a piece to the larger puzzle, right? So, and I think this goes back to what Ed Gainey talked about and what some of the youth talked about earlier. So part of it is there are many factors that lead to this, right? And you cannot address it by just focusing on one thing, right? It really is figuring out a way where the plan actually looks at the whole picture and then tries to move what it looks like, right? And so an example of that is a common theme that's been talked about thus far today has been trauma, right? Trauma, you've heard the term intergenerational trauma, right? And part of the truth of the matter is we are all products of a lot of different things, right? We are products of the environments that we grow up in. We are products, whether our parents want to admit it sometimes or not, we are products of them and their influence on our lives. Your parents have an influence up to a certain point in your lives, and then quite honestly, then it becomes your peer group that has the greatest influence. And then later in life, if we're all fortunate, we get back to what was instilled upon us earlier on in life, if we're fortunate enough, right? So one of the elements with this speaks to a lot of these different factors, and that's addressing the social determinants of health, right? Which consists of poverty, education, employment. And so I have a very strong belief that in order to help reduce gun violence, we have to address those issues, right? Education obviously has been very important in my life, right? It was important to my grandparents, my parents. My education was important to them, and hence it was important to me. Part of the difference nowadays and I think you spoke to this, was the fact that life today for youth is not the life that I had when I was a youth, right? And, you know, I did not grow up in Pittsburgh. I grew up north of here, up in Mercer County. But similar, and actually when I look at the communities now, the community that I grew up into is reflective of what Pittsburgh is now, right? So in my mind, it's always what can we do to help with the education piece, with the employment pieces. You know, growing up, any of you in the audience who are in my age group will remember where cities had things where they kept youth involved. I remember at one point, part of my summer job was actually going around cleaning up garbage in the city, right? I don't know that any of those things exist anymore, but it gave me something as a youth to do other than going to summer Bible school. So, you know, those sort of things. I would give you a prime example that one city within Pennsylvania is doing, and that's York. York has decided to help them address their gun violence issues. And then knowing the social determinants of health are a big component of that, they have a program where they are providing education to perpetrators of gun violence. So these individuals have to apply, and if they're accepted into this program, they get to go to college on a scholarship. So that's their effort to help educate. And they are starting with the folks that have perpetrated gun violence because they believe that their voices will ring true for those that are younger than them or maybe interested in gun violence. So that's what one city in Pennsylvania has undertaken.
Yeah, let's do this. Let's take a commercial break, then we'll come back. We'll get the 2 comments from you two, and then we're going to bring up our next panelist. We'll be right back. Oh, wait. Welcome back. Welcome back to Minority Health Matters. Excuse me, just before the break, we had some folks who wanted to react to the comments. We'll start with the mayor, and then we'll finish up this part of the conversation.
You know, this topic is so complex, Lynn, that there are multiple layers. You're absolutely correct. There's multiple layers to this. And there's not one size fits all. That's what America loves. We want that one size that can fit all. They want a microwave meal and it don't exist. You understand? Life is not a microwave meal. It takes 20 years to develop something. It takes 20 years to change a culture. So we're talking about a generation that has to change in order for something to grow up. And I say that because I believe in getting these kids. I believe in getting these kids. Let me repeat that. I believe in getting these kids. But getting the kid is only the beginning. Because you can put 1,000 programs into this child, But if you send that child back home to a house that is impregnated by the streets, it's going to birth death and destruction. So no matter how much you put into this child, if the people he are going home to are in the streets, or the streets is in their house, and let's be honest, we all know houses that you could go to when you was, no, not y'all, I'm sorry. We know, some of us know houses you can go to when you was a teenager, that you can go and it was party all the time, and that's exactly what it is. We know about older men loading up guns in front of young people, turning them out at an early age and making them want to be something that they don't really want to be in life. We know that. So you can get the kids, and we should. But if the kid is the goal, then we can't change that kid if he don't see a difference in mommy and daddy. The doc said it right. He had to go to Bible school. He didn't have no choice. You understand what I'm saying? That's what I meant by the church. See, you can't criticize when you're not present. The block is the battleground. You either in God's army or not. You got to make that choice. But that's where the war is at. It's on the block. You hear me? Because we glorify violence. Godfather, Goodfellas, Scarface. We glorify violence. Your daddy was all that. One of the best that ever did it in the hood. Man, your daddy was a drug dealer that's gone now. But guess what that kid want to be when he grow up? He want to be just like daddy. You understand what I'm saying? So let's not make it appear that this is so cut and dry, because it's not. That's a lie. Let the hypocrisy say that. The truth of the matter is, if we don't save mommy and daddy, if the kids see every single day, they will not change. Bottom line, get the kid to get the mommy and daddy so that mommy and daddy can advance in life, so the child can see a different mother and father than what he see every day, and you'll get a better product.
So I just wanted to add, I can't even imagine the fear, and the stress and the trauma that these kids and communities live in and day out. And particularly when you're a black young male, that forces more isolation, right? Instead of coming towards people, they go away from them. And what we know is that little things like connection, the CDC tells us that connecting is one of the most important things we can do to make people feel better. So something in living with this unimaginable trauma, when you check in with your neighbor, you check in with your friend, with your teacher, right? When we're there for each other as a community, that can start to kind of break down some of those barriers of help seeking. And by the way, lest you doubt the importance of this, there was a study that showed loneliness, the opposite of connection. Do you know it was equivalent to smoking 15 cigarettes a day? Wow. More lethal than heart disease or obesity. So this is a small thing in terms of these huge problems that we have to, conceptualize fixing. But can be a very potent thing when you think about connecting with each other and being there as a community.
So much of our conversation has focused on gun violence where there are not survivors. But in fact, there are countless people that are the victim of gun violence, and they survive. They end up often going through our very next guest. We're going to talk to a pediatric trauma surgeon who sees it differently. We'll be right back. Welcome back to Minority Health Matters. Our next guest is Dr. Ward Richardson. He is a pediatric surgeon and is certified in both general surgery and pediatric surgery through the American Board of Surgery. He is the director of the Benedum Pediatric Trauma Program and an assistant professor of medicine at the University of Pittsburgh School of Medicine. Again, full bio in the program. Welcome, sir.
Thank you for having me.
So, when I first spoke with you on the phone, it seemed I was confused because when I thought of a trauma surgeon, I didn't think of pediatrics. So talk me through that a little bit. You see more cases of trauma?
So, first of all, again, thank you for having us. It's such an important conversation to have. So, I think what a lot of people don't realize is trauma is a leading cause of death in kids over the age of 1. This is all causes, whether it's abuse, it's falls, it's car accidents. Trauma is the leading cause of it. And that's been that way for decades. I think the thing that is really sobering, I've been the director of trauma at Children for the last 5 or 6 years, and I constantly do talks about trauma, pediatric trauma, and when I first started, I would make use these charts about the leading cause of death, and within kids, within trauma specifically, and 5 years ago when I started, it was motor vehicle accidents. That was a leading cause of death within the trauma population, within pediatric world. About 3 years ago, gun violence surpassed motor vehicle accidents in terms of cause of death within the pediatric population. Not the overall population, within our kids. There are more deaths due to gun violence in the pediatric world than motor vehicles now. And what's sobering is you'll look at these charts about over the years of the numbers, and you'll see over time the motor vehicle deaths have gone down. And when you map those to things that happened, there were car seats that were in place, seat belts, there was texting restrictions. All these legislations were put in effect, and you can see the inflection point and it going down over time. Yet in 2019, 2020, you saw those lines cross. And gun violence, gun deaths actually surpass motor vehicles. That is, you've had these minor spikes, and they've been mostly flat over the years, and then we had a more major spike in 1920, and the lines crossed, and that line has persisted. So I think one of the big issues is with this is we try to look at it, as people up here have said, as is one issue. It's not. There are so many different parts of it. It's not one issue. When something is not one issue, you cannot have one quote-unquote solution. And unfortunately, I don't think anyone wants to hear this, there is no solution. There's not a solution. We have to make it better, improve things, but there's not a complete solution, which is a sobering thing. Just like there's no way we're ever going to make cars safe enough so there are no deaths. That's not going to happen. Does that mean we shouldn't do anything? No. And I think that's the problem a lot of people have, is we have this feeling of helplessness. That is nothing we can do. But if you save 1 life, you save 5 lives, is that nothing? So I think we all have these moments of despair, because you see no matter what you're doing, you still see these things occurring. Just because something's difficult doesn't mean we shouldn't do it. We shouldn't tackle it. We still have to be the change, the source of the change. I think a lot of people have, can touch on some of this a bit earlier, but I think we also have to be the models. I think it hasn't been talked about enough up here is the models sometimes that kids are seeing aren't the correct models. And this can be within the home. And without those models, they're going to emulate the bad models. So I think it's important that we be the change. We be the source. And it's not just our own kids. I think we all know kids that come over, they may be hungry, they may not have enough, you know what's happening in their household. Did you birth that child? No. Can you be a role model to that child? Yes, you can. So I think we have to be the change. We have to open our eyes and keep our eyes open. It's so much easier to keep your head down, ignore things that are around you. It is hard. It's hard to try to change things.
So let me ask you, when you talk about gun violence and the increase that we as a society are seeing, that is victims of gun violence as well as suicides, attempted suicides.
Yes, it's all gun violence. And I think we all know that we live in a very polarized society. So I think anytime you mention trying to change anything with guns and use the word guns, there is all of a sudden people have very strong reactions, both positive and negative. So I think it's important, and framing, how we frame things and stuff there. Because what we need is cooperation. We don't need arguments and stuff. We need cooperation. So how we frame this argument is really important stuff there. So again, sobering stats is more than 50% of the civilian guns in the world are in the hands of people in the U.S., the civilian population. So more than 50% of the civilian guns in the world, so we're talking about over 6 billion people, and the U.S. has a fraction of that. 50% of the guns are in the hands of people in the U.S. So there are a lot of problems, and the availability of guns in this country is a huge issue and stuff there. So we need to, which is it's hard when things are so emotional, we need to sometimes take a step back and take some emotion out of it so we can have a conversation. There can be no change without a conversation. And people do come from different points of view. But when you talk about protecting people, protecting our children, I think that's how we can frame some of the things. Because suicide is a huge, huge, huge issue and stuff there. And most people will often think that people have these long drawn out plans, and if someone's going to kill himself, they're going to kill himself. That's not true. Most of these are impulsive. And if they don't have access to lethal means, which guns are the most, they're not typically going to be as successful. Only a fraction of suicides are actually attempted with guns, but guns account for more than 50% of successful suicides. So if you have lethal means, you're going to have more success in doing it.
Can I just add to that for a second? So for sure, and what we want to think about when it comes to guns, you know, we know that men die by suicide more than women. And we used to think it was because of the methods they chose, because guns work better than pills, right? But there's been this important work that showed that it may actually be about that stigma, that help-seeking barrier. You know, the CDC had showed us that only 11% of male suicides had antidepressants in their system versus 41% in females, meaning that barrier, right, that particularly Black males and males in general are trained not to seek help and not to get the help they need. And to the point about being able to detect and prevent, we have to start. Did you know that 50% of people who die by suicide have seen their primary care doctor the month before they die? We need to be asking, like we monitor for blood pressure or do vision testing, or we won't find the people suffering in silence. Get this one. Did you know that 2/3 of adolescents who show up to the emergency department, who've tried to take their own lives, are not there for psychiatric reasons? Meaning if we don't ask everybody all the time and do it all out routinely, well beyond the doctor, but that's another thing that's important for people to understand in terms of starting to chip away at some of these preventable and treatable issues.
I want to switch gears on you a little bit because you and I had a chance to speak on the phone. Mm-hmm. We've talked a lot about fatalities, but many of the patients you see survive the shooting, survive the violence. And I don't think that we as a community process what life is like from there.
Excellent point. And I think a lot of people, especially young kids I interact with, have thought about dying. They're not afraid necessarily of dying. It's just part of their life. But they don't think about what it means to live with the consequences, either physical or emotional consequences of whether it's their action or other people's actions and stuff there. So the vast majority of patients I see who are victims of gun violence or perpetrators and get shot actually make it and survive. Some of them have more minor injuries where they don't even need to be admitted. Some need to have major operations and may have multiple operations. They may have pain for the rest of their lives. I've seen people paralyzed. And I think one of the important things, I can't claim credit for this quote, but a speaker I used to work with said the bullets don't stop moving when they hit that body. They keep rippling and moving for generations. I think as and sometimes these kids will need whether it's even something minor. I always often tell a story where there's a kid who got shot in his arm, in his axilla, and he was never at risk for dying. But he severed his nerve. He used his right hand. So his right hand essentially is useless. The thing is, his options are extremely limited now going forward. Is he alive? Yes, he's alive. But his dreams have changed. What he wants to do are changed. What he can do are changed. There are those who may, like I mentioned, may be paralyzed. They're not going to be able to live independently. Somebody has to take care of them for the rest of their lives. Whether that's their family initially, whether society ultimately, things are changed. And from the emotional standpoint, it affects people. It affects people, as you said, you being more anxious, jumping at little things, not being able to concentrate. And we often look at education as a way out and an equalizer, which it can be. But if you can't concentrate, you're having nightmares, you're not sleeping, these things add up. It affects parents and families. They may be more protective. They may not be able to be there as much because you can't really take care of anyone else if you're not taking care of yourself. I will argue and push back a little against Ed there. I think one of the big things is we have to change this. We have to be the example in everything. I think it's looked at, honestly, not just in the black community, but often in this machismo world, we have to be strong. Weakness is not strength. Showing emotion is not strength. When I'd argue showing emotion and showing you are is strength, and that we have to let our kids know that it is okay not to be okay. It is okay not to have the answers. It is okay to be quote unquote weak. I think we need to show them that and make it acceptable and okay to not be okay. None of us are ever okay all the time. I'd be lying if I said I was. No.
And asking for help is a sign of strength.
Mm-hmm. We're going to take another break. We're going to bring our next panelist up. We are continuing our conversation. We've talked about this from so many different perspectives. Joining us for the conversation now is the Reverend Paul T. Abernathy. He is the Chief Executive Officer of the Neighborhood Resilience Program. Father Paul Abernathy is an Orthodox Christian priest and the founding CEO of the Neighborhood Resilience Project. I'm going to stop right there, Father Paul, just because for some of our folks here, they may not know what the Neighborhood Resilience Project is. And you deal with the community, the family, after all of this stuff we're talking about happens. Tell us a little bit about the project and how it came into being.
Thank you so much, Lynn. It's so good to be with you and to the Gateway Medical Society. What an honor it is to be here with you all at this event, and how much I admire and support the work that you do. Mr. Mayor, so good to be with you, and Chantel and our distinguished panelists. It's an honor. I'm on a Hill District, and years ago when I came out of seminary, I was doing ministry like I believe we're called to do on the streets of our community, not really understanding what that really looked like or what that really meant, but just wanting to do something positive. Now, I will tell you, I came in to this experience being a veteran. I was in the United States Army, and I crossed into Iraq the very first day of the ground war in March of 2003. And I spent a year there at war for my country. Now, that was the first time I had ever heard of something called post-traumatic stress disorder, and that stayed with me. Now, years later, when I got out of seminary and went into the community, began ministry, something occurred to me. I began to get the sense that I was seeing so much more post-traumatic stress disorder in my own community than I ever saw when I was in the Army. We spent 1 year at war, but we have communities that are spending generations at war. And somehow we have, as a society, accepted this troubled reality. This was the beginning of a quest to address community trauma, because I believe that we can do something about it. I believe that. I mean, we put human beings on the moon. And think about how much, if we are motivated in the context of capitalism to achieve things for material gain, how much we've achieved. But what is it whenever we take into account the good of the human person? And where is that same will and determination? How can we leverage the talent and intelligence and resources that we have to make a difference? And this is where we begin to engage with local academicians at the University of Pittsburgh and Duquesne University to help us understand this issue of community trauma. And from that, we learned this exercise from the World Health Organization called a consultative workshop that is built on this premise. And I hear this all the time in this space. A lot of times, communities don't make progress because they are trying to solve issues. And issues don't have solutions. Problems do. The question is how? What is the exercise by which you problematize the issue? And that's what we started to do on this issue of community trauma. And from this, we began to develop this framework, which we now really refer to as trauma-informed community development. I believe where this becomes very relevant in the context of gun violence is that we have, for example, in Allegheny County, we have 30,000 blocks in Allegheny County. Now, here's what's interesting. The gun violence, which is a very pervasive issue, gun violence only occurs on 0.3% of those 30,000 blocks. Now, if my math is right, that's about 90 blocks. Here's what we need to know about gun violence. It is demographically concentrated. It's not everywhere. It's demographically concentrated. It's socially concentrated. It's in particular social networks. It's geographically concentrated. Now, what we need to understand, yes, is that with that, there's strategic intervention that we can do in these concentrated areas. Now, I want to speak just for a moment on the Chicago problem. That's what I refer to it as. The city of Chicago has put a great deal of resources into conducting research on violence reduction efforts. And they, I believe, are really crafting the way that we as a nation are considering how to respond to violence. Now, here's what I would argue the problem is. In Chicago, they haven't really figured out well how to reduce violence. But what they have figured out well how to do is to monetize violence reduction. And what this has done as a result, I believe, is undermine interventions that can actually do the kinds of things we're talking about. How often have we heard how important the village is? Trauma disrupts the village. That's what happens. And we do have this now epidemic of loneliness, as Dr. Vivek Murthy, the U.S. Surgeon General, now issued a Surgeon General warning declaring loneliness an epidemic, especially among this demographic. What if we had interventions that could do precisely that? But we are not having a chance to do that because right now the money is going to interventions that are really tailored to chasing down kids who are holding a gun ready to pull the trigger. Now, we have to do that. But we also have to understand there are many factors that have led that young person to that point. And if we are going to invest millions into chasing him with a gun, while all the while neglecting the very factors that have led him to that point, next generation will be doing the same. Dandelions are an impressive plant. I'm no botanist, by the way. But dandelions are an impressive plant because they grow on sidewalks. Doesn't seem like any kind of plant should grow on a sidewalk, but a dandelion will. And dandelions seem very, very resilient. And what my concern is that we are spending too much time trying to grow dandelions instead of creating gardens. We need to rethink these interventions, especially if we understand how it is that we can do that. We can disrupt generational trauma. If the Robert Wood Johnson talks about a culture of health, that to me seems attainable. And I believe, and in our work, we have been developing and continue to learn and to partner with people not only in the region but around the country to better understand what success in this realm looks like.
Let me first tell the audience that we are allowing for time for questions and comments, and we're going to be doing that next. So if you think you have a question or a comment, I will return, or Josh will, not right now though, we'll return the microphone to that microphone stand over there. And if you have a question or a comment, if you could gravitate to that area, then at least I can get an idea how many questions or comments we need to facilitate. So if there's something that you want to say, move in that area. I don't know if the woman who had a question earlier who had to leave, she left it. Okay, very good. So we'll get to those in 1 second. But Father Paul, let me ask you this, because one of the things that your organization has done is go into communities after an incident has happened, after a shooting has happened, after something has happened, and there is now a traumatized village there. Talk a little bit about that, and then what happens after you guys leave. I know what happens as the media. I know what happens when we show up and we do whatever it is we do, and then leave, and then that's when you guys are there.
We have to respond. We have to respond to the crisis in our communities. There for too long, and I think one of the I think more poignant moments in my ministry is when I was called on early in my ordination to go to a place where a homicide had just taken place on the Hill District, and obviously it was a very tragic situation. There was a darkness that seemed to rest on the household. There was a man who was killed in the house while the 4 children of the woman of the household were present. The youngest one, 2 years old, was the child of the man who was killed, watched his father die right in front of him. And what occurred to me in that moment is that we should be able to do a little bit better than just try to open up some kind of a phone contact list and call and see, I don't know, can someone come and talk to them? We don't know who. We should, as a society, do a whole lot better. And this is what really set us on a course to develop what is now the trauma response team. And the trauma response team is now a countywide initiative that we steward, in which in the aftermath of gun violence, we're deploying teams to help psychological first aid in the immediate aftermath of the gun violence. Our communities are incredibly unstable in the immediate aftermath of gun violence. Where is that stabilization work that needs to be done? By who? By us. What's really remarkable, too, is that when we started to do this, there wasn't much money to do this. And I will tell you, my personal response to that was, and our organizational response to that was, well, we don't need your money. Because if the civil rights movement was dependent upon a grant, and I said to them, I believe the people of our community will come forward and volunteer if you don't have money. And that's how we started, with volunteers. We have more staff now. We have 2 31-foot trauma response vehicles, and we still have volunteers because this is the work of our people. And we need to understand that in doing this work and coming forward, in volunteering and being the ones to show up. There's this proverb in Arabic, instead of complaining about the darkness, light a candle. We have people who are lighting candles. And we need to provide more vehicles, more opportunities, more pathways by which people can be the change they seek. So we are very, very committed to this. I think the wider question, Lynn, that you asked about what happens even after the trauma response team leaves, this is where we have a lot of work to do. And I'm going to harken back to this issue of recurring violence in the same places. We need to think more seriously about how we not have just an acute response, but what is that long-term intervention strategy in these very specific areas. I believe that the healthcare systems have an extraordinary ability here to reshape the way that we are thinking through this. If you really think about community development and who is at the table of community development, maybe you think somebody who can do good project management, people who have excellent relations with the banks, people who we refer to as quote-unquote developers. I would love to see physicians included in that list, because what I believe is that the goal of community development should not be profit, but I believe that the goal of community development should be community health and well-being. How can you pursue that goal without the healthcare industry? We need to rethink the way we are doing this. And, by the way, our healthcare systems are already dedicating resources to address what now Dr. Adair refers to as social determinants of health. We're not even necessarily asking for more money. We're asking simply to realign resources. What if we all work together, understanding where the targeted investment needs with the healthcare systems, with our local government? If we could convince the feds to go along with this, if we could convince local corporations to go along with this is their problem too. So our corporations, this is their problem too. The future of our city depends on this if they want to be a corporate presence here. If we could align this investment, I believe that we could make an extraordinary impact.
I wanted to add to that. So the president, the White House, just announced that they opened an office for prevention of gun violence. They're going to have billions of dollars to dedicate to that. So here's, moments where people can bring these very important issues, to be able to do that. And I also wanted to say, in terms of the taking care of the community in the aftermath, that means everybody. You talked about that 2-year-old that witnessed that. Do you know that what we learned from 9/11, even preschoolers who were indirectly not even close to what that 2-year-old had to expose, they had a year of behavioral issues and sleep disturbance. So even our littlest ones, our whole community, we have to think about what the effects are and what we can do to care for them.
I really appreciate that. And I will tell you, there's this phrase in the trauma-informed world, because I am obviously, no surprise to anybody, a huge proponent of therapy. A huge proponent of therapy. And there's this phrase in the trauma-informed world, you don't have to be a therapist to be therapeutic. I'm going to tell you, my grandmother was therapeutic. My neighborhood was therapeutic. We need to understand as a community what really therapeutic interaction looks like. We need to cultivate those skills. We need to build that capacity. We need to raise up people who can be a therapeutic presence in community as assets in community to build therapeutic communities.
There's one thing I want to add, because we talked a lot about the therapeutic side of mental health, and I think it's good because I think really not only I needed to hear it, so let me just be honest, a lot of what was said today, I needed to hear, but there's a flip side that, in my eyes, all ministers, all doctors, all psychologists, anybody that's dealing with mental health, there is something, like during the civil rights movement, we had something that we were marching for, and that was freedom. That was the ability to be able to be seen as an equal. We understand, and Martin Luther King said it best, that one of the things that he missed out was that he wasn't more on the economic side of it, the capitalistic side of it, to be able to fuel a lot of the operations that he felt was needed in order to move communities out of poverty. They have something that they passed in 2005 called the Protection of Lawful Commerce in Arms Act, which protected the gun manufacturers and the gun sellers from being sued. Now, last time I checked, hospitals, communities, therapists, counselors, when we talk about a need for money, each one of them should be on the front line right now asking the government, the federal government, to repeal the 2005 Protection of Lawful Commerce in Arms Act. Why? Because instead of the White House giving us $50 billion, if they allow states, cities to sue gun manufacturers and gun sellers for the illegal activities that they've done by knowing that their guns are responsible for millions of deaths on these streets, in 10 years, you will see a reduction in violent crime because you'll be hitting them where they don't want to get hit. It's called in the pockets. When we change the law to impact mental health and start suing gun manufacturers and gun sellers for our children, we can get life.
We're going to take a break. Again, I see folks waiting to ask questions. We'll do that when we come back. Welcome back to Minority Health Matters. We have questions in our audience.
Thank you, panelists, for your insightful presentations and authentic presentations and sharing your truth. I'm Dr. Evans, Director of Community Engagement at the University of Pittsburgh Department of Surgery. And our efforts these past few years has been around establishing academic and community partnerships. And I would really like to ask each of you to speak in a short word of how we can be more impactful in creating bi-directional dialogues and opportunities to solve problems together.
Oh. Y'all don't want to go first? Are we going down the line? You know, one of the things that I think that we have to understand is that there's a difference between issues and interests. Issues get talked about forever. Interest gets a return on its investment. And I think that when we bring groups together and we got 21 things we want to accomplish, 21 things we want to hit, and you get nowhere. As someone that worked at the state level and understands how people come in with their interests and how their interest gets funded, one of the things I always tell people, what are we meeting for? Like when I meet with people now, I want to know, what are we meeting for? What are we meeting for? So, for instance, I'm meeting with a group of people now to talk about the 2005 law I just talked about, other mayors. I'm talking to the mayor of Cleveland, the mayor of Rochester, everything. I'm talking to them right now about how we as mayors need to come together and ask the federal government to repeal this law to give us the right to be able to sue gun manufacturers and sellers. Why is that so important? Because now I know what the vision is. The vision is repeal the law. The mission is save lives, and the way of saving lives is by ensuring that we can sue gun manufacturers and gun suppliers. So at the table, I'm not coming here to hear 21 different issues. I don't care about that. What I care about that is what is the overall goal of why we're here. And for me, if the goal is the 2005 law that we're going to repeal, that's all I want to talk about. We can get the second vision later, but we can't get to the second vision if we ain't accomplished the first one. And so my whole thing is, let us focus on one thing. In the neighborhood, everybody comes to the table with 21 things they want to do. And you know how much we get done? None. But when you come to the table with one thing you want to get accomplished, it brings the right partners. And you know, I told people when I was running, I don't need your support. See, your support to me is that if it's a beautiful day, you may go vote for me. I need your commitment. See, with your commitment, I get your support. But without your commitment, I only have support that you'll show up when you want to. I need you to show up every day. I need you to be willing to go get it every day. See, everyone ain't a preacher, but everybody's a minister. What is your lane? And in that lane, make it happen.
I believe some of the things that need to be done is back in our communities with our kids. It was stated earlier, there was a lot more available when we were younger. Even when I was a child, there was the YES program. I got paid to learn to be a mentor. It wasn't much, but as a 13-year-old girl, I'm getting paid to write an essay and present and teach other kids to be a mentor? Sign me up. You know, we don't have these things for our children. There's not many resources out here for us. If they don't want to play baseball, football, or cheerleading in the summer, what do they have to do? The camps are too much. They cost too much money. Half of the families can't afford it. So what do our kids do when their parents are at work because they have to feed them and put food on the table and they have nowhere to be? Going to the Ave. I think we need to get back to concentrating on our communities, on our children. There's a couple programs out there, but everyone has their own agenda. No one wants to work together. And then they want my organization wants to be seen for participating. right? Not for the goal, not for the outcome, but I want to be the first one whose name is written down that I participated and helped. We don't need that. We need people who's willing to work together for the end goal. I don't need to come in and put my name on everything just to say I helped. I just want to help. And I think we need to get back to that. Like I said, our village. We need to build that foundation of us working together. Because if they don't see us working together, they'll never work together.
I appreciate your question, Doc. I appreciate your question. And I believe that we need, it is of utmost importance that we need to foster very strong relations between community and academic research. I believe it's very important for a couple of reasons. Number one, policy is always going to be driven by research. We might know what the answer is, but I will tell you, unless we are able to present some hard research that reinforces why we believe this is the answer, a lot of times our policy recommendations don't really advance. That's very important. Secondly, I think in terms of validating our own work, making sure that we actually are making an impact, we don't want to just say, trust me, it's me, I'm making an impact. I think for me, it's very important that we know whatever it is that we're going to do, it's okay. We need to foster a spirit of innovation in our communities. And that's very important. And I believe that's the responsible thing to do as long as we have the right kind of evaluation process in place to ensure that this innovation is actually productive, not counterproductive. I believe those are very important. Now, I think in terms of how we really foster that, there's also, I believe, a couple of things that are very important. Firstly, what I have had the experience so often is that academicians who are indeed busy, who are trying to publish so that they can get tenure and all these sorts of things, they are busy, which so often happens to me. Because really, I think if you have a reputation of being a good, willing partner with academic institutions, this will happen to you frequently. I get so many emails saying this, essentially. Father, can you please write a letter of support for this grant that I'm going to submit? For this program, we'll get you guys in, we'll train you guys how to do this, we'll work on this intervention, et cetera, et cetera. I want to be good partners, I want to support that. A lot of times we issue letters. When these things happen, when they're actually executed, sometimes I really ask community members, what do you think of this? And they say, in a very polite way, I might not have done it exactly like that. And this is where we have to develop the good kind of co-design process. I'd much rather get an invitation to say, hey, Father, you guys are on the front lines dealing with this. I want to meet with you and understand what you believe the problems are from your perspective, not you personally, but your community, maybe a way to do that, and then enter into a co-design process that helps us develop together what we believe this intervention we want to research will look like. That doesn't happen very often. And I think we, on the academic side of things, need really to challenge that. Now, here's the second part, which I believe is of utmost importance, and that is around the issue of intellectual property. And I've asked sometimes researchers this. Let's say we partner with you. Let's say we co-design something, and then let's say it actually works. Who gets the intellectual property? Because whoever gets the intellectual property, yes, gets to financially benefit from that intellectual property. We have, at the University of Pittsburgh, if I'm remembering this correctly, the National Institute of Health gives research dollars. I believe the University of Pittsburgh is the largest recipient of NIH money in the nation. I think it's 80 million annually. The second largest, I believe, is 40 million annually. We have a company on the south side, I believe it's still there, making artificial lungs. You know what? We have all of these things that are being developed at the University of Pittsburgh with this NIH money, intellectual property. In the Hill District, people talk a lot about retail. I see this artificial lungs on the south side being created, developed here in Pittsburgh, has relevance all over the world. And I think, why isn't there an academic partnership that leads to the development of something that is of great benefit that has a global expanse that we can create here? I would love to see answers to these questions from academic partners. And I believe that if we can create a scenario that will be mutually beneficial, by the way, all the publications, I believe, should be co-authored. Let's not just say, you know, doctor this, so-and-so this. If a community member helped design and participate, they need to be on, their name needs to be on the papers. We got to co-author these publications. I believe that if we do this, we could see, as a result of these research dollars here in our region, extraordinary impact.
Dr. Evans, great question. I think money obviously makes the world go round. And there's a lot of things that would be nice to have. But I think to echo some other things said up here is I think there are actually a lot of people out there, a lot of programs out there that are trying to do things. But as I've said before, they're not talking. I think there needs to be a conversation among these things. And some of the programs I'm involved in, what I've found that people don't know about them. So there can be some resources for some of these things, but the people who need to take advantage of them don't know about them. Or they may be limited, they can only do so much, which is fine. That is something, but then there may be this other group that can help out. So the conversation needs to be had among all these groups who are trying to help, who are trying to do things, because they're out there. And I know some actually have more resources than people taking advantage of them, because people don't know them. There isn't, if you try to, because I've done this, try to search for these things and stuff, it's overwhelming. You're like, is this what I need? Is that what I need? Is this, you call that person? No, you need to go this person. It's very confusing. Even somebody who has a lot of literacy in this area is confusing. So you take somebody who has no literacy in this area, it's impossible. So we need to have a conversation among groups. We need to make these more accessible. The other thing I think is extremely important is we look at these things as crises, which they are. And people are often there in the acute setting. But oftentimes people aren't in the right mindset, the right frame set to take advantage of these things up front. We need to have people come back around. It's not just when it happens. It may take months for things to settle down for them, where they're available, they're ready, they're willing to do these things. So it can't just be one-time intervention. These has to be recurring offerings. Trust me, I've seen oftentimes people would say, no, they don't want to see you, get away from me. Then a few weeks later when they're home, they're back in their environment, you have to call. Oh, yeah. Yeah, maybe I will take that card. Maybe I will make that call. But we need more conversation among ourselves. We need to work together more with ourselves. Different organizations, different people bring different things. But all the community needs all of these. Then we need to make them more accessible for the community. Because, again, there are groups out there, there are organizations, we're all part of them. But the community doesn't know about them. It's hard to figure out, it's hard to find.
Yeah, so there are models that show us that community coalitions are the best thing that we can do. So you bring stakeholders from the academic, the church, the police, the school, and we know for centuries that when you get good minds in a room together, you're gonna group problem solve in a much more innovative way than if you're out in your silos, right? And so we know that that's, and I don't know how many there are directly on this particular issue. We have them on lots of other things, suicide prevention, et cetera, and that's what we need to do. And the other point I wanted to make, I'm an academic, right? And I know we need that science to serve the community, right? But as a scientist, what we also need to do is tell the story. Why is this important? The messaging. You can have a lot of great things, and if you don't tell the story and you get it out there, it means nothing. And we know that fuels policy, and policy fuels impact, right? So that's what we need to be thinking about.
Being the last one of 6 or 7 of us, they've covered most of what I would actually talk about, but I would just leave you with this, is that from my perspective, it's always about dialogue and being able to be willing to have conversations. I think partnerships partnerships at state government, local government, academics, and the community really is what helps drive things forward. So that's really what I would leave you with.
Dr. Conte, before you ask the question, let me just say this. We are approaching 20 minutes to 2. 2 o'clock is our out time. As much as I love you, Dr. Evans, let's direct a question to a panelist and not all 6 of them, just for the sake of time.
Well, thank you all for participating. I will let the panel decide which individual is best to answer the question. You know, as an EMS physician, I've gone into the homes, I've gone into the cars, I've gone into the schools, I've worn the flag vest. I see the impact of violence every day. As an emergency physician, I see it every day. As a pastor, I've seen it every day. And as a father of 6 boys, I've lived it every day. My question/issue is that despite all the conversation, what we don't seem to be talking about is the school environment. We have one of the shortest school years in the world. We have one of the shortest school days in the world. In Pennsylvania, the only compulsory minimum requirement is 5 hours of school per day. So one solution that comes to my mind is if it's called compulsory education because we acknowledge that the child brain needs molding and children need education. So how can we in Pittsburgh, in Pennsylvania, be innovative and make the school day longer? Just making the day longer puts our children in safer spaces for longer periods of time. Parents won't argue against it because the parents already are struggling. How do I manage from 2:30 p.m. till 6 p.m. when I get home? What my child is doing for those 4 hours, I can't even control because I'm at work. So why not make the school day from 8 to 8? Why not make the school, I mean, seriously, if we're talking about the leading cause of death for our children is murder. And we already know in school districts around where we all live and work, significant numbers of our children can't read, can't write, can't add, can't make sentences, and are not doing well in school. So why can't we? So while we're working to figure out all of the other things about what to do with that extra time, how can we create the extra time? Because just for example, if your child is struggling, say in math, they don't have a choice to see the math person. So if we know our children are struggling with behavioral health and we make the school day longer, then every child has therapy as part of their schedule. As part of their schedule, because even the well-adjusted child needs therapy. Just like in reality, every child should have an IEP, because every child is individual. So my question to the panel, whoever might, is how do we try to encourage using the school environment and the school day as a way of supplementing what we're saying our children need and don't have, is the question.
Sounds to me like that might be a political question or a therapeutic question. Okay, all right.
Because I want to piggyback, because I want one of them to answer for me too, because I'm not, as political as you guys. I agree with you. 8 might be pushing it for me. What I would say is before we even reach the fact of extending the school days, what about closing our schools down in our neighborhoods? If you look at our black neighborhoods, our neighborhoods that are poverty, all of our schools are getting closed down. Wilkinsburg doesn't even have a high school. Wilkinsburg has to go all the way to Westinghouse, where they're not even bused to go to school. Shenley has been shut down. Rasenstein has been shut down. How many schools have been shut down? How are we educating our children? I understand wanting to extend the days, but we have to have somewhere to educate them. We have to be able to provide them with the proper education. How do we do that? How do we get back to providing our kids with those places when all of our schools are being turned into condos?
You can give that to the mayor. You can give that microphone to the mayor.
You notice the mayor was quiet. So you ask a good question. That is very complex. I'll be honest with you. So let me first start by saying I don't have your answer. And I think that's part of the problem, is that we're always looking for answers instead of solutions. You know, I tell my team all the time, don't bring me an answer, bring me solutions. Solutions 1, 2, and 3, and we can get to the answer. But if you bring me an answer, it's got to succeed or fail. So one, I think it's the wrong mentality to look at something for an answer when we're in the business of solving problems. And in solving problems, I like that because I'm known to say that if you don't have a problem, then you don't have a promise of a better tomorrow. So you got to look at your problems as a blessing, because in every problem, there's a promise of a better tomorrow. He gave you that for a reason so that you could have a testimony of where he brought you from. Without a problem, there's no testimony. So first and foremost, I just got to be honest that I don't have an answer. Number two, I think that you would have to look at it from a collective bargaining agreement with the teachers union in regards to what they will want, because the teachers are already overworked now, and I believe that you need social workers in the classroom. Number three is that we don't pay our teachers enough money right now to be able to justify asking them going 8 to 8. We just don't pay them, and that's criminal. It's a crime. When I was at the state level, I fought for teachers to get an increase in pay all the time, because you can't ask them to do a great job, ask them to take care of their family, and they're not even making the money that they should be making. It's wrong across the board. The last one I want to get into, because I think it's a great topic, and I'm glad you brought it up, about our schools. It's powerful. You know, I tell people all the time that when I go to Cleveland, Buffalo, you know, even in West Virginia, Philly, D.C., Baltimore, that the average neighborhood is 15 square miles, right? So the average neighborhood in those cities is 15 square miles. That means one neighborhood in this city, if we were really doing it and we got 90 neighborhoods, one neighborhood would be Garfield or East Hills, Garfield or Wilkinsburg. That would be one neighborhood, because Homewood is only 4.2 square miles, right? Homewood is only 4.2 square miles. So at the end of the day, with a declining population, we went from 900,000 to 300,000. That means that if the population is shrink, so has the students going to school have shrink, because we don't have 900,000 people in our neighborhood. We only have 300,000. So of course the student enrollment is going to shrink because the total population has shrinked. And when they were closing schools, what they should have done was did a capital campaign to build super high schools that would have took in those areas, those geographical areas, to create an updated school system, because most of our schools are like our rec centers. They're outdated. They're outdated. They don't have AC. They don't have proper heating. They don't have proper water treatment. They're outdated. When we were beginning to talk about closing schools, instead of looking at it at the deficit, we should have found out how we could create a surplus where we could have had our kids in the state of our school, which we could have competed on multiple levels with everything. We didn't do that. All we did was close schools. They got the same school because they got to get out early if it's too hot. No, my opinion, and be it right or wrong, is what I believe. I believe they got the right superintendent. I believe Dr. Walters is the real deal. But I also know what Dr. Walters inherited. He inherited a lot of the problems that we're talking about today. And see, we get so excited that we want a microwave meal. We think he can change it overnight. There ain't no microwave meals in development. It's going to take time. And we got to be patient and work together. When I walked in, there wasn't even a relationship with PPS in the city of Pittsburgh. Mm-hmm. The mayor and superintendent didn't even meet. I told Dr. Walters, how can I ask our children not to be violent, and we sitting there having violent, not me and him, but the previous administration and them having violent conversations? Oh, let me say this. because we always promoting the negative. That's what I'm talking about. Be careful what we promote. It's not that we can't talk about the news because it's all real. But we're down over 40% in children homicides. The city is down 40% to where we were last year when we took over. We intentionally went after the youth. I go to the schools. I bring them down to the mayor's office. I talk to them. I had interns that went to PPS. In each one of them, they got college courses, they got college credits, they got paid, and they got to learn about city government. And for the ones that was fortunate, which was 2, I had 2 interns that was with me every day. Now I want you to think about if you between the ages of 13 and 18, and you can walk around with a mayor and hear conversations about police and community relationships, gun violence, parks and recreation, over the overmaturity of deers. You can hear all these conversations. When I was done, I had one come back to me and say, you know what? What I thought about government is different now that I had a chance to follow you around. But I tried to explain to him, yeah, but I'm not your average mayor. I'm different. You understand what I'm saying? Like, my team can't understand. When I was in Homewood, they said, Mayor, why don't they call you mayor? I said, I grew up out this way. I wish I would go to one of them and correct them about calling me Ed Gainey. Do you understand? I don't care about no title. The title is my key to make it happen. Everything else is about relationship building. I don't care what you call me. I know who I am. The mayor don't make me. I make this title called mayor.
I'm going to jump in here now, Mayor. Mayor Gainey. I'm going to jump in here now because we still have, several questions. I want the woman who had left, I'd like to get you up next if we could.
Thank you all so much for coming out. This is what is called unity in the community. It's called a wealth of knowledge, making a difference. My name is Javon Rainey. They call me the mouth from the South. I'm the mother of 3 adults, 7 grandsons, 5 granddaughters, and a new addition on the way, a little girl, but I have a grandson. I invested in my community because I believe in my community. And the reason I say that because of the partnerships. I say unity because I have learned to look at this city. I migrated here. I'm a country bumpkin, and that's why they call me Mouth from the South, with BPEP and other entities, Mr. English, NAACP. I was just newly elected as the first black woman for the Northside Public Safety Council. I vested in my community because it's about making a difference, because I have 7 grandsons. And every time the TV comes on with violence, I think about my grandsons, okay? And I'm like, what do I need to do in my community? This is my community. This is my home. And we got to be boots on the ground. I'm with John Lewis Transformative Justice Coalition. It's about being out there. And I remember in 1985, when I came here, we did the first Moms, what was it, Mr. English? We did Moms for Madness or something like that. My children were afraid for me to go out there and march. And it was in January. Y'all know how Pittsburgh is in January. I said I would lay my life down for my children in the community because they had threatened us because we had to march. And I told them they can take this body, but they can't take the spirit. And the reason I say this is we as people— I don't want to
cut you off, but time is short, so if there's a question—
all I'm saying is this. Let's have another symposium like this, please. Please, let's do this. But Pastor D is my pastor at Pittsburgh High Ground Ministry. She talked about why we don't have enough therapists in the schools. We have one at our church. That's one. The other is why not the 100 Black Men Club is not here, because they're right here on the campus. That's where her son's at now. And this is once again with the little people going in with the mentors of in the leadership role and the community. All I'm saying is this: we have great minds, we have great thoughts, we have great leaders. Let's come together and make it happen. Reduce the violence for our Black and brown children.
Dr. Adair, do you want to respond to the therapists in the school? And again, I'm just going to ask everyone to be mindful of our time.
And I will be very mindful of the time. I'll just quickly get to the point. There are several reasons why there are not enough counselors within the schools. Part of the issue is we don't have enough in the community, period, right? So part of it is, how do we then increase the number of individuals who want to go to school to end up being counselors? And this goes to if you remember in the very beginning when Journey to Medicine was up here. So it's organizations like that. It's organizations that encourage and support and mentor youth to these types of professions. And there are a number of different reasons why people don't go into them. One of which goes back to, as you said, with teachers and pay, right? Human services as a field is very underpaid. So a lot of people won't go into it because of that. These are all issues, though, that are currently at several different layers are being looked at in how we get more people involved.
Perfect. How many other questions do we have? You have a question? 1, 2, 3. You were supposed to be over there. Okay.
First and foremost, thank you to our panel. Thank you for everybody that put this together. I just first want to commend Chantel. I know her personally, and it's just an honor to see her here. I was actually neighbors with Stephen's father for years, his name is Steve also. And I just know them as a family friend. So I just want to commend you for being here. And I hope that you continue to share your story and keep Steve's memory alive. I just wanted to share some resources. So I don't really have a question. I work for BPEP in the Coalition Against Violence. Every month since January, I've been having what we call Community Peace Summits. And these summits are designed for basically what we are having here today. It's for conversation, it's for healing, it's for peace, it's for resources, okay? So every month we have different topics that we go over, everything from bullying to specific specific problems such as violence against women and girls, really just working on a lot of the issues that we're talking about today. So I heard us talk about suicide, mental health, a lot of the things that we know our youth are, really just being plagued with. So me personally, I have a 15-year-old son, and I started noticing back in like 2008 when he was in middle school that he started having certain issues. So me as a mother first, I started looking into resources on how I could help my own child first and foremost, right? So there are resources out here, as we all know. For an example, when we talk about suicide prevention, there's something called ASSIST, which stands for Applied Suicide Intervention Skills Training, okay? So I'm a survivor of suicide. So I made it a point of mine to go out here, learn this skill set, learn this training so that I can now get out here and help others. We talk about mental health. There is a youth mental health first aid training, which I also went out here and took. So I'm saying, start doing your research, start seeing what is out here, because there are different things that we can get trained and skilled on so that we can go back into our communities and be that person of healing that these youth need. Another thing I wanted to briefly talk about is, again, in Mayor Gainey, we talk about this a lot, is, again, the parents. Quick story. My nephew, he goes to Penn Hills High School, which Penn Hills is out of control right now, okay? We talk about PPS, but Penn Hills, it's out of control. My nephew got into a serious fight about 2 weeks ago. The person he fought, the father of that student, brought his child up there to shoot my nephew, okay? So it got to the point where we had to have police called and, interventions and everything. So my point is, again, we have to get back to our parenting and making sure that these parents who are out here, a lot of them are addicts, a lot of them are just, dealing with poverty. We have to be able to provide resources for them first so that they, again, can get back to parenting and being the parents that they need to be to their youth. because we have to do this together as a community. This is not a me problem, you problem, this is a us problem. And again, we know that we have to work together. So that's all I wanted to add. Thank you.
Perfect, thank you. I'm going to try to get these last two questions in.
I just want to make one comment too. Thank you for your comments there. And I think I wanted to make a comment on your shirt. I think that's one of the key issues. We need to use our voice. And the way we use our voice is voting. And voting is not just national or citywide. It's at the school boards and stuff. There, if you look across the country, lots of school boards have been packed, and they're getting things done.
Mm-hmm.
It's not necessarily positive, but they're getting things done. So we need to pay attention. We need to use our voice, and the way we use our voice is vote. Vote people in who support things we want. Vote people out who aren't doing the job we want. So we need to use our voices. We have a voice, but largely our voice is ignored because we're not using our voice. We have to make the people that make policies, make decisions, listen to us. And the way we do that is using our voice by voting.
Good afternoon. My name is Reverend Dennis, and thank you all so much for your quality time and expertise. I have served in the AHN network for 23 years. I'm pre-K, so I understand ministry, and that's what I was born for. I've dealt with a lot of suicidal victims, mental health victims, if you will. And I'd like to just make a suggestion. I don't know if it's even doable, but Mayor Gaynor mentioned about it beginning at home as far as these children. And it's very true that teachers are helping to be mentors. They're sometimes parents to these children. Ministers, reverends, preachers, they're the same thing. They're mentors, they're role models, they're parents to these children. But the truth is, it does begin at home. So I'd like to even suggest to Dr. Adair, I don't know if this is something that the Department of Human Services could do, Mayor Gainey, to make it mandatory for parenting classes to be a part of, if you will, breaking that generational curse of women being on welfare most of their life and having baby after baby after baby, not dealing with low self-esteem. But it really does begin at home. So they can break that generational curse if they were taught. So if we know better, we can do better. And thank you, Mayor Gainey and Dr. Adair, for answering that question. Thank you.
So I don't know that Mayor Gainey would have any different response than I would to this, but there's nothing that from a government level that would allow us to mandate something like that to individuals. You know, we can certainly work on trying to educate people in again, having dialogue about things that we believe are needed, but we're not, the way democracy works, we cannot mandate that. So,
unpopular opinion, devil's advocate. I think welfare kind of makes it easier for women to sit back and have baby after baby after baby and not get a job and not want to provide for themselves. So I think if there are harder restrictions and stipulations put out there, then those people will be forced to get up and not want to do it. But when you make it easy, they're going to take the easy route.
Okay, we're going to take, we got two other questions. These will be our last two. I'm going to ask you both to make them as succinct and directed as possible.
We've talked a lot about different ways we can fix the problems, like how it starts at home, how people need therapy, how we need to eliminate stigma. I spent a little bit of time in Australia, and the craziest thing to me while I was over there was them saying that guns, nobody's allowed to have a gun unless you're an officer. And when they told me that, being used to the culture in the States and being here, that blew my mind. So considering all the things that we talked about today, I was just wondering from a political standpoint, when does it come to maybe gun control? When does it come to eliminating that? And at the end of the day, is that a conversation we need to be having? And I just wanted to know what you guys' thoughts were on that, really.
That might be a different symposium. That might be a symposium unto itself. So I don't know, is there a succinct answer to that?
I mean, there's nothing else we can do. The federal government controls gun laws, and the state is able to do gun laws. The city is not able to preempt gun laws. We can't make any type of gun laws at all. We have to rely on the federal government and the state. And with the power of many gun advocate groups and the lobbyists that they have and the amount of money that these lobbyists are paid, I don't see this moving anytime soon. We've got a couple gun laws moved this time, two under Biden and two at the state. But even at the state level, it has not passed the Senate, which means it's probably not going to be made into a law by the governor. As long as we're not able to preempt gun laws as a local municipality, there's nothing we can do.
So,
but we can fight for some things. There's some things we can fight for.
Yeah, the short answer to your question is yes. The amount, like I said before, the amount of guns in this country is insane, and that does lead it. And a quick thing is, everyone always talks about Chicago and how Chicago has Illinois has all these gun laws, but they have all the guns. But it's economics. If you want to make money, you're going to bring your product to some place where they don't have any. So places that have lax gun laws around there, bring it there. So the answer to your short answer to your question is yes, we do need it, but we have to be realistic. We can't look at what is ideal, what we really want. We have to find common ground. Everyone knows the country is so fragmented right now, and if you stick to exactly what you want, nothing's going to be accomplished. You have to be willing and reaching out and seeing what common grounds are. Talk about, like, so we do many things with children's, and when we meet these people, we talk about just not taking away anyone's gun, talk about safety. So we need sensible things to keep people safe.
But you can't get sensible gun laws right now. You just can't do it. It's too extreme. We've been pushing gun laws for the last 30 years, and we've not been able to get it because of extremism in Washington and Harrisburg. As long as you have far-right Republicans out there that don't want gun laws, that control the government and have majority of the votes, you're not getting nothing passed.
It is about money.
So you can pass.
It's whoever pays their
But hold on, you can pass if you have my majority of the House and the Senate. But right now, the reason why gun laws have not moved in 30 years is because we have not had total control of the House and Senate. And before the governor or a president can sign anything in the law, you have to pass it by the House and the Senate. In the House and the Senate, in committee, gun laws have died or have been voted down. And that's in the last 30 years. So we got to be clear when we're talking to the public exactly what we mean. The only way we're going to get responsible gun legislation is if you got Democrats that are in control of the House and the Senate and a Democratic governor or a president that is willing to sign it into law. Other than that, it's a fight we have to continue.
Like I said, that's a symposium unto itself. We can revisit that. This will be our final question.
Yes, real quick, two things. Fear. Fear is like, it can motivate you to do positive things. It can motivate you to do negative things. It can also freeze you where you won't do nothing at all, you know? What we need to do is to change the language in the community. And this is dealing with all that, with the trauma and everything, you know? Because one of the most hurtful things you can say to anybody in the black community is to be called a snitch. I'm telling you. That word is like so archaic. We need to eliminate it from, you understand, our vocabulary. And you talking to, look here, I'm a corner boy. I come off the block. Ed know that. Me and Ed was doing this stuff 10, 12 years ago, you know? But I also know that as long as we hold on to that, our community men are not going to grow and they're not going to be safe. And it's hard. And the reason why it's hard, because these are our kids. These ain't nobody else's kids. These are our kids, you know? So you know what? I know Ed's son shot that guy down the street, but me and Ed is cool. So I ain't going to say nothing about it. We got to get past that. Because you know what? He might have shot and wounded somebody today. Tomorrow he might kill somebody. You know what I'm saying? And we definitely need to get away from that. You know, when you talk about like snitching and stuff like that, hey, you got to be involved in a criminal episode to be called a snitch. If you ain't involved in a criminal episode and stuff, right, you know, then there's no such thing as snitching. You know? I took the term snitching and I turned it into positive concern because that's what it is. Real quick, Len, when you get right down to it, who's your first responder? Is it the police? Is it the fire department? Is it the ambulance? Which one is it? It ain't none of them.
The neighbor.
It's your neighbor.
The neighbor.
Your neighbor is your first responder. You understand what I'm saying? You need to get to know your neighbor because you know what? The way you protect and making communities safe, you lock that community down one street at a time. You understand what I'm saying? One street at a time. I'm telling you what I know because I've been here. I've been watching it. You know, I know how it gets done. You understand? Because like I said, I come off the corner. I know what it takes to get it done.
Don't give him
like I said, me and Ed been doing this for a long time.
And just for the record, when he's saying Ed shot somebody, it's just using me as an example. Because no, listen. Now listen, you right, player. Hold on for a minute. See, my press secretary, Olga, you see her go away, get ready. So she wanted me to make sure I reiterated that since me and Bert go back and we know one another, he's just using me, which is cool as an example because he's my man. But he doesn't mean I was out there shooting. No. Olga, I got it. It don't mean he was out there.
I'm saying because for real, right?
Make sure to caption that and put that disclaimer on there, please.
On that note, what he just said, I was just using him as an example.
We got you, don't worry.
I could have used myself as a better example because I've been there and done this.
Right.
You know, I still got scars and stuff within the clubs out my back and stuff like that.
I mean, I agree with you.
But let me tell you this, right? And I'm so serious about this, man, because like I said, I am a corner boy. So when I talk about snitching and stuff, right, people listen because of where I come from, you know? But I don't live like that no more. And we make our community strong, man, we change the language in the community. We have to start talking to each other. We got to kill that word. Where they talking about, man, snitches get stitches and stuff. Yeah, well, you know what? Them same guys that made them T-shirts up, let something happen to one of them family members. The first thing they'll do is hit the block, and they want all the information they can get, and they don't care where it comes from.
Where it comes from. On that note, I'd like you to thank our amazing panel for quite the conversation today. And before we finish up, I'm going to have Dr. Jan Madison, who is the co-chair of the program committee, to come forward with some closing remarks.
Thank you, Lynn. Since it's a little after 2 and we like to stay on time, I'd like to thank all of you on behalf of Gateway Medical Society and the Journey to Medicine for coming to our program and for being so involved in the conversation. I'd like to thank the young men from Journey to Medicine for bringing up this, their concerns and being the nidus for this town hall. We did provide some resources for the individuals at the conference to use and share on gun violence and mental health. And I really would love to thank the panelists for being here and anyone who knows Gateway. Once we become your friend, you're stuck with us for life, and we really hope that we can work together to make a difference, because I think what we've learned in Journey to Medicine is that our young men grow up fast, our young boys grow up fast, and they'll be running this city, this country, and we want them to be involved in the processes that will be going forward, so we all need to be engaged with them early. And our girls too, but I'm a little biased to my Journey to Medicine young men. I grew up in the 60s and 70s, so my brother had a poster on his wall of Eldridge Cleaver, and it's the one thing that has stuck with me for my whole life. If you're not part of the solution, then you're part of the problem. And I want all of us to become part of the solution. However, I still want Lynn Higgs Freeland to come up here and close this program. And I want to thank Tamara Reese over there trying to hide for her amazing work in coordinating this program. And Lynn and her idea from Minority Health Matters that, hey, we should do a town hall. And on behalf of Gateway Medical Society and Journey to Medicine, we want to give Lynn a card to thank her for her hard work. We want to make her work to the very end and say the final goodbye.
Again, a very special thanks to all of our panelists. Some of you I met today for the very first time, but I got your number now, and I got all your cell phone numbers, so you will hear from me again. We want to thank each and every one of them for spending this time with us. And again, we said it's not going to be talk. We do have some solutions. We got some concrete things that we can do, and now the challenge is to keep the conversation going. So thank you all very much. Have a great afternoon and travel safely.
Hey, Lynn, can we get you over to your picture, Paula?